Good morning, everyone, and again, on behalf of the Philippine Health Association, Pharmaceutical and Healthcare Association of the Philippines, I'd like to thank everyone for joining us today in this very important forum. As you're aware, the PHAP has committed itself to support access to innovative medicine on universal healthcare platform. It's always been the center of what we do as an organization. This year, in building on the achievements of the previous administration and sustaining the momentum into the new leadership, PHAP crafted Universal Healthcare 2.0, summarizing learnings from years of collaborative work with different stakeholders towards accelerating universal healthcare or achieving health for all. PHAP put forward 4 strategies. First, to strengthen primary care and outpatient systems. Second, to involve all of government, especially the local government units. Third, to engage the private sector and other stakeholders. And finally, focus on the patient and their power of choice. These strategies are very much aligned in this administration's Achieve strategy with its battle cry, all for health towards health for all. Now, to achieve universal health care, we strongly recommend reforms should focus on prevention and primary management. A strong primary health care and outpatient system that focuses on prevention and primary health management is necessary. This will enable the public health system to be more efficient and cost-effective in the delivery of healthcare services to all Filipinos in all levels. The shift in focus will maintain the financial protection of the poor in critical care and simultaneously reduce the total burden of disease and increase total human capital productivity. Now, what needs to get done? Well, we strongly recommend that the next step for PhilHealth is to expand its current coverage of services, which includes provision of services and medicines for primary care and outpatient setting. This is something we heard loud and clear at last year's forum. In fact, one of the resource speakers, I cannot remember his name, he said he's willing to increase his premium payment so long as outpatient services are covered by PhilHealth. Investments in infrastructure and human resources continue to be a key consideration we still have to focus on, as we still have a number of Filipino patients who are unable to access basic health care. There should be greater oversight to ensure that health facilities adhere to standards, high-quality standards, and should be properly accredited. Perhaps we need to revisit the RHCU model to ensure that it is still responsive to today's needs of our community. Given a devolved health system, the local government units need to be more involved. The immediate rollout and integration of DOH, PhilHealth, and LGU programs can help achieve the system's goals. We've seen great examples of how, when LGUs are engaged and involved in promoting and supporting health, they're able to achieve significant results. Actually, we're going to see and hear some examples during this afternoon session on Towards Frontline Healthcare. We heard from the prior speakers that reform is a collective effort. Studies on health sector reforms around the world and in many countries highlight the success you can achieve in healthcare when both the public and private sector work together in a collective effort to make real differences in the delivery of affordable and quality health services for all. This afternoon, we will hear from sectors who are at the forefront of closing the gaps and proposing solutions to pervasive health issues in the session's imperative of sustainable implementation. Now, I hope you agree, in the center of what we, all of us here, do is about the patient. The focus should be the patient and their power of choice. To do that, there has to be a few considerations. One, there has to be early access to life-saving drugs and technologies, even diagnostics. This should be facilitated through the improvement of the Philippine National Formulary listing process. The list must be dynamic and regularly updated so that patients who depend on government assistance for cure especially of fatal diseases, can have access to new life-saving medicines. The list must be consistent with recommended latest treatment guidelines to allow public health providers to provide the best healthcare for their patients. Second, an institutional mechanism where key stakeholders, including patient groups and the industry, are involved in developing the list. This will help them make the process more inclusive, transparent, and effective. And we also would suggest that the process perhaps not be made too cumbersome. Third, the safety and efficacy and quality of medicines must be ensured through good regulatory capacity, backed by strong enforcement. Now, over the past 3 years, the FDA has increased transparency, accountability, and efficiency owing to the adoption of electronic systems and other streamlining efforts. Sustaining these reforms already are underway and meeting the daunting requirements to perform its mandate, they need more resources to be able to do that. There's also a need to establish an automated health information system. Data is key, and data will enable us to make good decisions regarding systems and healthcare. Better decisions can be arrived at when it's supported by data, and we know it exists. We just have to collectively think together on how to leverage this information. It is our vision that life-saving medicines, vaccines, diagnostics, and other technologies are made available promptly to those who need them. This requires having an effective supply chain management system in place, starting from raw material supply, manufacturing, regulatory policies, and procedures, quantification, procurement, warehousing, inventory management, among other processes. It's very complex. However, we know there are experts who can walk us through that process. In support of the government's agenda for health for all, the industry stands ready to partner with the government and other stakeholders in finding solutions to help close the gap in access to medicines and make health for Juan and Juana a reality. I look forward to this afternoon, today's presentations, and look forward to continue to collaborating with all of you. Thank you.
Thank you, Ms. Martinez, for putting forward recommendations to accelerate UHC in the Philippines. We request you to post your commitment on the wall.
So as an industry, we commit to collaborating with government and other stakeholders to ensure early access to innovation.
Once again, thank you, Ms. Martinez.